Good morning, colleagues. Good afternoon, good evening. Welcome to GSS informational webinar. Today's session is on the UN Booking Hub, UN Systems Booking Hub, medical and wellness services delivered by WFP. And we have here today the team of experts from UN System Booking Hub that's managing the overall system, as well as the medical and wellness services, which is a key service for country offices and entities that are managing clinics and medical services in country. But also it's a very useful tool for colleagues that are traveling on mission or basically visiting any duty station where there is a medical facility. And the team will give you an overview of what the system is and how it works and how you can benefit from this. We have the team here, Alessandra, Flavia, and Clementina, that are going to introduce themselves as they speak. And without any further ado, I'm going to give the floor to Alessandra. And then after the presentation, we have an opportunity for the questions and answers. Alessandra, over to you, please.
Thank you, Zamir, and welcome to everybody to this interesting sharing of, let's say, news and information for us to collaborate better together. First of all, really very, very sincere thanks to our DCO colleagues for organizing these webinars. It allows us to, potentially discuss with the colleagues interested in services, innovation, with new ideas. Every time we have interesting discussions, and it's a moment also for us to learn, the appetite and the interest on the potential interagency collaboration. So thank you so much again, Zamir, and the entire team for this opportunity. With me, exactly as I said, and Clementina working on with me on the Human Booking Hub, and Flavia also. But without losing any more time, by the way, I'm Alessandra Bianchini. I'm in charge of a branch called Global Shared Services and Business Development. So basically what we do since many years, we're focusing on setting up internal and external global shared services, consolidating, through digital transformation, through policy, let's say, changes, and also, organizational shifts. We are consolidating some of the enabling services, common services, because they are probably the easiest ones to be streamlined to find efficiency gains. So going to the next slide. Thank you for, I think, Flavia, to do that for me. Okay. First of all, just 2 slides to give you like the context of what we are talking today. So first of all, we're very happy to say that we are one of the, let's say, big UNSDG endorsed global shared services. Definitely, we are the largest UN marketplace for shared services, the UN System Booking Hub. As you can see, we managed, so we started it more than 10 years ago. We started for WP internal provision, but then some agencies asked us, UNHCR, UNICEF, and many others, to actually access and use the platform provided to WP operations. So we started providing services also to other colleagues having the same problems that we had in running their own operations. So far, as you can see, we have managed 6.2 million service requests. I think they are much more than this, but my team is not very, let's say, very quick in updating the data. But anyway, for sure, 6.2 million service requests to at least last month. But apart from that, as you can see, we have many service lines. So we have the largest interagency fleet, let me say, made up of 9,500 vehicles from 21 infectious agencies that are providing mobility services to the platform. We have more than 500 HUNAS flight destinations that you can book through the service and manage through the service. We have 275 guest houses. We have UN DCO hotels, which are, updated on the platform for colleagues to see the reference or where to sleep. We have 45 clinics and more, and Flavia will elaborate on that one. We have more than 100 common facilities, which are already availing of the, meeting room booking, interagency meeting room booking system. And I think we should also add in here the new online auction service, which we launched, with the FAO and with OCHA for providing, our operations and operations of any agency which is potentially interested, a modern way to dispose of assets through modern online auctions. Through an online application. Of course, we're 21 UN entities, so it's not that we have 21 UN entities actually make up the hub. The hub without these partners providing services to it would be empty. Therefore, the entity is really the interagency collaboration that makes this collaboration platform successful, because really the more we are using the same platform, the more we can share business data, the more we can catalyze investments for something that we develop and then is immediately widespread to all agencies using the same service. So there are many, many reasons why the global shared service is a winning model. And also we know from the report of the General Secretary that we're calling for a shifting paradigm where we want to scale up common services and also use having a reversible shift to global shared service. And so I'm happy and proud to say that we actually have been mentioned in the General Secretary report under the scale up of common services. As you can see, we were referenced as a success initiative, example of a service that would actually need to be leveraged to keep building up more interagency collaboration in common services. And so in that, let's say, spirit of this confirmation of the fact that our, collective vision this is not a WP, let's say, initiative. As I said, it would be an empty platform, but it's a collaborative platform. And so the collective vision is the right one, and the General Secretary report confirmed to it. Let me hand it over to Flavia for her to deep dive into specifically the service that we're talking today, which is the very much interested one on medical. Flavia, over to you.
Thank you, Ale. Hello, everybody, and it's a pleasure to guide you through the demo, actually a presentation and a demo on the medical services booking solution of the UN System Booking Hub. This is Flavia. I'm the Change Management Officer for the Booking Hub for several services, including medical and wellness services. So this booking solution is, as all the solutions of the UN System Booking Hub, is an interagency platform that allows for managing, in this case, medical and wellness services in terms of appointment, invoicing, and all the administrative aspects of these services. This started as a field clinic booking solution in 2018 and has, of course, since developed and matured. And today it covers a lot of medical and wellness services, not only medical clinics, but also a wide range of services such as lab testing, counseling, psychotherapy, physiotherapy, travel clinics, and any other wellness service that requires basically scheduling. Of course, it brings benefits as a UNSDG global shared service and has been endorsed by UNSDG, and as an interagency collaboration, which brings, let's say, live UN reform principles and also UN80 principles, as we have seen in the report that Alessandra just mentioned. It helps providing service excellence with solution that is a UN-wide solution, so it's a UN common, and can bring, of course, streamlining of all the services within the UN community. And of course, by maximizing resources utilization, because it increases the access to services and also increase its utilization, meaning that enhancing access, then the same staff accessing the services can be more aware of what is offered to them. It brings overall efficiency gains. At the moment, the platform includes 47 service points in 16 countries run by 3 UN organizations. And as to date, it has helped managed almost 100,000 visits. What are the kind of services that can benefit from adopting this solution? So as I said, it started as a field clinic booking management platform. for a single clinic or a network of field clinics, of course, for both internal delivery, so within the same organization, but also for interagency use, especially at field level. However, this has actually evolved, and it is now commonly used also for medical and wellness services in HQ or global offices, which can be open to all local staff. And this means, for example, in HQ to the same agency staff, but it can also be used in global offices which are interagency, so that the same platform, the same unique entry point can offer the service to all the agencies and colleagues in the headquarters. It can be used for counseling and psychotherapy services, especially because, as we are going to see, there is also an online appointment modality, which is particularly pertinent in the case of counseling psychotherapy, because it expands the reach of this service not only to the local staff, but also globally in other countries, of course. Any other service which is appointment-based, which, for example, can be physiotherapy, specialist visits, consultations, even events, specific events, they can be managed through the platform, through the same modality. Of course, the platform is completely customizable, as we're going to see in the demo, so that it can be shaped to meet the needs of any service delivery. Finally, recently, we also launched the use of the platform to manage lab testing and other services with tight scheduling, because the appointments are automatically assigned, and this helps in these kind of services which are really have a tight schedule, even if they are run by external vendors. So lab tests, for example, sometimes can be run by external vendors, but there is still the need to use the platform to register all the appointments, collect all the data, and also increase the accountability of these external vendors running the services. What are the advantages of the solution for the operation and also for the final staff? There are several. We can see now 4. First of all, as I was mentioning before, the increased utilization of services due to enhanced access. So even if the service is offered only to the same agency, having it on a platform gives it a lot of added visibility, which in turn helps enhancing the access, and then, of course, the utilization. Of course, there is a reduced workload through the automatic assignment of appointments, all the automatization offered by the platform in terms of managing the appointments, the creation of invoices, the creation of reports. And all this automatization in pair with enhanced accuracy, because the data is collected through an official login, which means that is mostly correct. This leads to the possibility to use resources in a wiser manner. And then in turn, of course, as a final benefit, this leads to the possibility to make decisions which are more informed and are based on accurate data and on the feedback of both the service managers and also the final users, so in this case, final patients. Without losing more time, I would like to show you the demo of the platform so that you will understand what we're talking about. So I'm going to move to my browser screen here. For anybody who doesn't know it yet, this is the UN System Booking Hub. You can log in at unbooking.org. You can do it even after this demo and just give a look around. The platform is accessible through automatic login with your UN credentials, so you don't need to create an account. And you will be able to see around and see what services are available to you. Indeed, when you log in, you might see a slightly different homepage than mine, because the login is based on your UN credentials, and based on the organization you belong to, you will see the services which are available to you. So I might see something because it's available only to WFP. In your case, you might see something that is available only to your own organization. You can have a look around and discover what's on the website. At the moment, we focus, of course, on the medical services. So to show you the wide variety of services available to be booked in terms of medical and wellness, I wanted to show you the page that we have for WFP, which is just an example, of course. On this page, we have the wide variety of services, and these are all managed through the same booking solution. So in this case, we have a standard primary care clinic, the lab testing. So you can see that each service has its own page with the description, instructions, anything that is pertinent for patients to know before and after they book an appointment. So this can be completely customized, buttons can be added, and information can be shared so that you will have the possibility of having one page with all information that is needed by your staff. The same can be done, of course, for other services, as I was mentioning. So in this case, for example, this is a physiotherapy service and has its own page with its own information and details on, for example, medical insurance and fees, applicable fees. We can also set up pages for events. So in this case, there is a flu vaccination event running at the moment, and this has its own page with all the information, its own booking, etc., etc. So this is just to show you that in one entry point, your organization can have all the services offered and available, and as I was saying, enhanced access, because I might come for booking the lab testing and I will discover all the other services the organization offers to me. In order to book a service, each page has its own booking form that I'm gonna access now in this test location. As soon as I access the booking form, I can see already the first batch of high customization available for this type of booking solution. Indeed, here, this booking form can be completely customized based on the service delivery. Each one can have its own, because of course each one of the service, being that they are really different, can have different needs in terms of data to be processed in order to process the bookings. So for example, in this case, I'm asking the phone number. If for a service the phone number is not needed, I can just deactivate this and completely customize the booking form for my needs. In this booking form, we also have the appointment modality, and this can also be turned off or on, meaning that I can activate the possibility for patients to book online consultations. So if I select online, as soon as I book the appointment, the appointment will be confirmed, and I will receive a Teams link that will allow me to access a unique meeting on Teams for my appointment. Moving on, as soon as I need to select a preferred visit date, I have the possibility of selecting an available day. So in this case, this is a instant booking functionality, meaning that as a patient, I can book directly appointments without the service manager accepting them. So if I select an available day, I will click on time of visit and I will see only the slots available for that specific day in my time zone and the clinic time zone. So I can choose, for example, this one. Choose a reason for consultation, so why am I booking an appointment? In this case, I will see the services provided by this specific clinic, and then request my booking and confirm. The booking is confirmed. As a patient, I will receive a confirmation email, and I will just need to show up for my appointment. If instead I book an appointment which has an orange background, I'm gonna book in waiting list, meaning that my appointment is not confirmed because the day is fully booked. However, I can still request, show my interest in having an appointment, and then it's the service manager who are going to process my request if there is a time slot which becomes available. This is everything actually for the patients, and of course, as a service manager, I still have a full control of the appointment booked through the back office of the platform. Before going there, I just want to mention that this is the instant booking functionality, which is type of booking that is more advanced, of course, in terms of time saving, because the scheduling is done automatically by the platform. However, we also have the possibility of setting up what we call a standard booking, meaning that patients are not going to be able to book directly the services, but they're just going to request a specific visit date, but then it's going to be the service managers processing them. This is, while it is, of course, less automatized and therefore less time saving, however, it gives more control to the service managers on the service scheduling. So this is really up to the operations what they would like to, what they prefer. And of course, we can move from one service, from one type of booking to the other with time. The back office, we call it digital office, is the restricted area of the website accessible only to service managers to manage their own service. I'm going to show you how it looks like. It's here. And from here, as let's say, for example, as the admin staff of this clinic, I'm able to manage everything related to my service. First of all, of course, the appointments. So through the calendar, I'm able to see all the appointments booked for a given week or a month, etc. Of course, I can navigate through the weeks. I can modify an appointment. I can duplicate it. I can make it recurring. I can move it around. I can delete it and replace it with one in waiting list, for example. So I can do any action. So even though the scheduling is automatic, I still have the possibility of completely controlling the appointments book for my clinic. If I want to manage the availability of my clinic, I will go through the section operating hours. And this section allows me to have a full control on the availability of the clinic in terms of when the appointments can be booked. This means that I can manage the normal operating hours. So if there is a change on the normal scheduling, I can always update it here by myself. Or I can also set up specific operating hours for specific days. For example, if there is a national holiday, I don't need to change the normal operating hours of the clinic. I will just block the national holiday day, and nobody will be able to book an appointment in those days. In the section settings here, I can manage the customization that we were mentioning before. So I can manage booking form fields. So from here, I can activate, deactivate, and mark as mandatory specific booking fields. If I would like to add them, I can do it from here and then just save. I can also activate reminders for my appointments, meaning that I can decide how many hours in advance the platform will send an email to remind the patients about their appointment. I can further automatize the waiting list, basically assigning automatically the slots that become available to whoever is in waiting list. And then finally, I can set up a minimum notice for bookings. So this is to avoid last minute bookings. If this is something that you would like to prevent, you can always put up a minimum notice and then have the system blocking the appointments however hours in advance you would like to block them. So usually medical services are, in the most of cases, they're offered on a cost recovery basis with agreements between organizations. However, if there is a payment that needs to be done by the patient, this can be done through the function invoicing. So in invoicing, I have the possibility of creating invoices for each one of the appointments, just retrieving quickly the information about the patients. So it's going to take me 2 minutes to create an invoice. And once I create it, I have the possibility of downloading them, of course, both in a full version for the patient or in an anonymized version for the third-party invoice. Anonymized meaning not the name of the patient, but the diagnosis. and then to create an automatic report of all invoices generated for a given month that I can export and share with insurance companies, for example, if needed, or with my partner organization so that they can see the patients that came to my clinic, and I can create and I can charge them for the service. Then I have finally this section that is called reporting. The section reporting is really interesting. It's actually a new addition, and it's showing me all the data of my service for a specific time frame that I can decide. It can be 1 month, a specific month, or it can be even multiple months up to a maximum of 2 consecutive years. This means that I can see the trend of all the data and what is happening, how my system is being used. And I open here, I see not only the main KPIs. So, for example, I can see that in November I had 25 bookings, of which 23 were confirmed. 1 was remained in waiting list, so was not attended to. And this will tell me if this number is high, I will know that I have to increase the number of doctors because I have a lot of bookings in waiting list that I need to take care of. 1 was cancelled, etc. Then in the detailed statistics of these 23 confirmed visits, I can see the percentage for each agency. So I can see that my service was used mostly by WFP for 47%. Then the second agency for utilization was IOM, then UNSDG, and then UNICEF, for example. So this will help me in understanding the type of patients that I have in terms of organizations. And then below I have some statistics that tells me some information about my type of patients. How many male, how many female, or how many not specified if this field is not mandatory. How many online consultation, how many in person, and finally how many dependents, so how many appointments were booked for dependent and not for the staff themselves. In the section feedback, finally, I can collect feedback from my patients. So as a patient, as soon as I book an appointment, I can leave a comment for the clinic, which is visible only to the clinic staff through this section. And from here, I can see the comments that were left. I can visualize if perhaps a lot of patients mentioned that my clinic is missing a laboratory. I can export this and use this feedback to be shared and perhaps brought to the upper management to push for including this service because it's actually really required by the patients. So this is all for this demo. Of course, if you are interested in knowing more, we're always available to give you more information. So please, if you'd like, you can contact us at our address clinics@unbooking.org. We can organize a demo for your specific service. We can see actually and tailor the system and understand how we can help you. You can test our services for 1 month with absolutely no strings attached. You can, of course, visit the website, and you can also consult all the information and materials that our colleagues from DCO will share with you.